I'm Jamie Burgess, Senior Vice President of Marketing at Qventus. We are here sitting down with world-leading surgeons, clinicians, technologists, and hospital execs, talking all things AI. I'm joined by Dr. Jason Cohen, our Chief Medical Officer of Inpatient Solutions at Qventus. Jason, thank you for being here.
Yeah, of course, thank you.
So we recently launched our 3.0 version of our inpatient solution. Talk to me about what's in that solution.
Yeah, of course. So the Qventus Inpatient Solution automates the 4 key components of effective discharge planning that we know really health systems achieve outcomes, reduce length of stay. The first of those is making sure every patient has a personalized discharge plan. So we have machine learning models that identify when patients are likely to leave the hospital and where they're likely to discharge to. Every patient has that early, accurate plan by the first morning after admission. So that's foundational. The second piece is how we then optimize, how we sequence the use of ancillary resources to best achieve those discharge plans. So things like physical therapy consults, MRIs, echocardiograms, really important that you're getting those tests done at the right time so that those patients are actually able to leave on time. Third part is care gap orchestration. So we have a Qventus logic engine essentially working in the background, looking at each individual patient, looking at their care plan, their care pathway, and identifying if there are any potential gaps, and then taking action on behalf of the care team to fill those gaps, to orchestrate action. So if a patient's missing an order, for example, we'll go ahead and write that order for the provider and put it in front of them next time they're in the chart. So they can just sign that order, get on with the rest of their workflow, and we make sure that patient doesn't hit a delay, that missing order doesn't end up keeping them from discharging on time. The fourth piece, and it's critical, is really real-time analytics, real-time dashboards for your managers, for your directors, giving them the insights they need to have in the moment of what they can do to most impact those discharge plans. So, for patients discharging today, these patients on your unit, if you're a nurse manager on a particular unit, these are the things you need to do to make sure these patients discharge. Similarly, those reports exist at the facility level, the system level, so that all of your leaders know the steps they can take, the places they can be most impactful with their time to make sure patients are able to discharge. In addition to that, we also identify those specific processes that we know are most contributing to prolonged length of stay for the hospital. So we have a robust set of benchmarks, both internal and external, that we're able to help leaders understand which of those processes are most contributing to those excess days. So when they're making decisions about where we need to put our energy, where we need to put our resources, and what that impact can be if we do, they have this guide so that they understand how to be most impactful.
Got it. So really moving beyond sort of a system of record and just surfacing data to actually taking action for the providers.
Precisely. We are a system of action. Folks have an EHR. They have Epic or Cerner or Meditech or what have you. Those are great systems of record. There's lots of places to write things, lots of places to record what's happening to the patient, but they're not designed to prompt action. They're not designed to help patients move through the system effectively. That's why you need a system of action sitting on top of that, prompting providers, prompting nurses, case managers, et cetera, where it's appropriate, taking action for them where you can, making sure patients are getting the right care at the right time.
And so we just announced our AI operational assistants a couple months ago. Mm-hmm. Talk to me about the use case of those assistants as it relates to inpatient.
We know there's all sorts of things we could be doing for patients that we don't today, mostly because we just don't have the bodies, we don't have the people. Most of our teams are kind of trapped in a lot of manual processes that leaves them not operating at top of license. It is most exciting to me as a clinician is being able to do post-discharge follow-up calls. So right now we know that's a best practice. It helps reduce readmissions, provides a lot of security for those patients when they get home, being able to talk to someone before they maybe follow up with their primary care doctor. So the ability to actually talk to an operational assistant who knows their healthcare background, who knows the medicines they're supposed to be taking, who can do education with them and use techniques like teach back that we know are associated with improved learning and better compliance. That's super exciting from a clinician standpoint. When I'm a hospitalist, when I discharge a patient, knowing that they're going to go home, have all their questions answered, know that they're taking the right medications, know that they're following up as they're supposed to, that's hugely reassuring to me from a clinical standpoint, but it also means those patients are getting better outcomes.
So I think you set up a lot of the challenges that hospitals and health systems are facing today. How does our inpatient solution solve some of those?
Yeah, great question, Jamie. So we know one of the problems healthcare systems have today is just achieving early alignment around a plan for each patient. care teams are busy. We know that there's this saying discharge planning should begin on admission, but it's really hard to do just because we're all running around trying to take care of the urgent needs of our patients. The inpatient solution makes sure that every patient has a personalized plan. So as soon as that patient hits the door, we make sure that the care team knows and is aligned around when that patient is leaving and where they're likely to discharge to. And then that enables us to orchestrate action around that plan to make sure that patient's able to leave on time. So we have things like flow prioritization working in the background, making sure each patient is getting the right care at the right time. We know getting a PT evaluation for a patient who may be going to a skilled nursing facility in 3 days is more of a priority than getting a PT evaluation on a patient who may be going home tomorrow. We know that the sequencing in which we do things for patients has a tremendous impact on their ability to successfully discharge on time, the overall efficiency of the health system, our ability to open up capacity and create that room for those patients to come up from the ER, from the community, from outlying health systems.
So you've talked a lot about how our technologies can improve the experience for frontline healthcare workers, enabling them to provide better care for patients. There's also a big value piece here that we're hearing from our customers. Can you talk about some of the ROI that Qventus unlocks for inpatient clients?
For sure. So, going back to that idea that patients are spending, on average, maybe a day longer in the hospital than they need to, we're able to reduce that from anywhere from 15 to 30%. So bringing that down, we've had some health systems been able to reduce their length of stay by as much as 0.92 days. What that translates to down the line is that those patients are leaving sooner, those beds are open, patients are able to come up from the PACU, from the ED, from outlying health systems. That means more elective and semi-elective surgeries you're able to complete. It's the decreased costs associated with those patients. We had one health system in the Southeast. They reduced their average length of stay by about half a day. And what they saw was a 20% increase in volume year over year compared to before they went live with the solution. Now, 20% increase in volume with the same physical plant, the same staff, that's a huge outcome, right? Like, I don't think it was all Qventus, but it was really great to be part of that success.
And talk to me about our partnership with Ohio Health and the results that we drove there.
Yeah, Ohio Health has been a tremendous innovation partner. They not only adopted the solution, but we've worked kind of side by side with them to develop new aspects of the solution, things specifically targeted to their particular strategic priorities. They were able to reduce their overall length of excess days by 15 to 20%. Again, as a clinician, the thing that excites me about that translates to additional capacity, cost savings for them. I think they paid for the solution within the first 75 days or something. Wow. They were live, it was less than 3 months. And so they're seeing a 7 to 10 ROI over the course of the year. From the clinician perspective, what excites me is looking at things like their ED boarding rate. They actually, at the same time they saw that reduction in length of stay, they also saw a 15% reduction in the number of overnight ED boarders. Again, that sounds like, oh, that's great, patients didn't have to spend the night in the ER. What that actually translates to is an improvement in mortality. We know that patients who get a bed and are able to get up to the floor sooner have lower mortality compared to their peers. So not only saving money, not only paying for itself, huge ROI, but saving lives, which is why we're doing this.
Last question. We've had offline conversations about the fact that healthcare can't grow their way out of the problem that we're in. Can you kind of talk, what do you mean by that?
It's very tempting when all your beds are filled to say, oh, we need more beds, right? And try to go raise money, build another wing to your hospital, et cetera. The problem today is that you could go build that hospital, but you're not going to be able to find the bodies to actually staff it. We have this huge nursing shortage. We have a shortage of key roles throughout the hospital, whether you're talking about MAs, case managers, et cetera. So even if you could build that hospital and had the money to do it, you still aren't going to have the capacity to actually care for the patients that you want to care for. The only way out of this, the only way to meet our mission as healthcare systems is actually to get better at delivering care, at moving patients through the hospital frankly, at the pace they deserve, right? Like, no one wants to spend longer in the hospital than they should. So by doing the right thing for patients, by doing the right thing for care teams, you're actually doing the right thing for the community and the health system as well.
Yep. Sounds like we have to simplify how healthcare operates.
That's a good idea.
Well, thank you for being here, Dr. Cohen.
Yeah, thanks so much, Jamie.